Well, here in Texas, football is king, whether it's in the cities, suburbs, or small towns. The Texans love their football teams, especially high school and college. Now, with our fixation, the recent cardiac arrest of Buffalo Bills player Damar Hamlin has captured the attention of a lot of people. Joining us to talk about athletes and heart issues is cardiologist Dr. Fahmi Farah. Dr. Farah, thanks for joining us here on the program. First, most cardiologists seem to agree Damar Hamlin suffered from commotio cordis, which resulted in cardiac arrest. I don't want to assume anything, so I just want to verify what your initial thoughts were when you saw what happened to Hamlin.
I think that's definitely one of the possibilities because he did get a blow to his chest, and commotio cordis is exactly that. Whenever we get a big pounding impact on our chest, it can cause the heart to stop temporarily, and most of the times it can restart, but sometimes it doesn't. And that can cause that person to go into cardiac arrest and collapse, kind of like what we saw on the field. But it could be a few other things as well. For example, there is a condition called hypertrophic cardiomyopathy. Usually people are born with it, and the scenario that we saw, it's a pretty classic presentation for that condition. It basically means that the heart is a little bit enlarged in those people, and they tend to go into arrhythmia, where the heart can go into erratic rhythms such as ventricular tachycardia, and can cause them to collapse during strenuous activities such as a football game.
Well, considering all that information, Hamlin's collapse was pretty jarring to see, especially considering he is such a young man. And we know Texans love sports, especially football. Concussions are a concern, and now this. So what should parents consider when enrolling their kids in sports?
I think when it comes to prevention of something like this related to the heart, screening is important. There are very simple screening tools available to just assess what the heart condition is, especially if there's something pre-existing like hypertrophic cardiomyopathy that could be easily detected with just a simple EKG and an echocardiogram. So I am a proponent of screening before putting your kids into contact sports like football or basketball.
I'm willing to guess that you're also an advocate for people getting CPR certified. Can you explain the importance of doing that?
Oh, absolutely. I think CPR certification is so important for anybody who can get it done. And, an example of how important it is this very scenario that we're talking about. It's absolutely life-saving. When somebody has a cardiac arrest, especially an out-of-hospital cardiac arrest, the chances of survival is extremely low. And part of the reason is because that delay to CPR, because not many people know how to administer CPR properly. So as in this example, the reason he survived and he although he's in critical condition, but he's still alive, is partly due to that CPR. So it is absolutely life-saving, and I encourage everybody to get trained for it.
Real quick, Dr. Farah, early reports said Hamlin received aggressive CPR, which sounds misleading. Doesn't CPR need to be aggressive to keep the heart pumping?
Absolutely. CPR is aggressive. You're compressing on the chest. So it's very aggressive resuscitation. And so by definition, it is aggressive measures to save somebody's life.
Okay, Dr. Farah, that's all the time we have for today. Again, we appreciate you being on the program.
Thank you so much for having me. It was a pleasure.
Well, thankfully, Damar Hamlin is on the road to recovery after that scary incident last Monday. He posted this message on Instagram saying, quote, "The love has been overwhelming, but I'm thankful for every single person that prayed for me and reached out." During pregame warm-ups this weekend, all 32 NFL teams wore black shirts with the number 3 on them. Teams are also spray painting blue or red around the number 3 on the field's 30-yard line. Hamlin remains in critical condition but is breathing on his own, and doctors say his neurological function is excellent.